Hi, my name is Cynthia Pamela Guañaquinte. I am going to talk about chlamydia complications. Definition: chlamydia is a common sexually transmitted disease. It is caused by the bacteria Chlamydia trachomatis. It can infect both a man and woman. Women can have chlamydia in the cervix, rectum, or urethra.
Welcome back. In this video, we'll be talking about the characteristic features of chlamydia infection and the different types that you need to know for SIP1 exam. Now, chlamydia infection is an obligatory intracellular organism, meaning that it cannot live outside the host cell. And the reason behind it is that it depends on the host ATP for its own metabolism. We can diagnose chlamydia by using DIMSA stain or fluorescence antibodies. Now here's the life cycle of chlamydia infection, and this is very important to know. So usually the chlamydia would be presenting as elementary bodies. These elementary bodies will be endocytosed inside the cell, and they will transform into reticular bodies. Now using the stains, you can see the reticular bodies. This is actually the bodies that we see using the stains. And the reticular bodies will transform into another elementary bodies. And these elementary bodies will be exocytosed outside the cell to infect other cells. So in short, the elementary bodies are the bodies that are infectious and that we cannot see using the stain, and they are much smaller. And the reticular bodies are the bodies that we can see using the stain, and they're not usually infectious. Now here are the types of chlamydia infection that you need to know for step 1. The first type is trachomatis, and it transfers by sexual intercourse, and it causes Reiter syndrome, which is also known as the reactive arthritis. Type A, Type B, and Type C all cause a disease known as African blindness disease, and they happen to be chronic, unlike trachomatis. Just remember that A, B, C can cause African blindness, and it's chronic. So A stands for African, B stands for blindness, and C stands for chronic. Type D all the way to type K, so basically type D, type E, type F, etc. all the way to type K transmits by infected vagina during the delivery to the newborn, and it causes urethritis, pelvic inflammatory disease, pneumonia, and eosinophilia. So it's the only type or the only classification that can cause eosinophilia. Type L1 all the way to L3 causes lymphogranulomas. So L and lymphogranulomas starts with L as well. And this basically presents as painless genital ulcer and painful inguinal lymph node ulcer. The inflamed inguinal lymph node ulcer is also known as pubis.
Application in nursing. Application in nursing: wash your hands frequently. Use a latex condom to avoid spreading chlamydia and the other STDs. Talk to your sexual parents. The regular STD tests. Do not have sex until you and your parents have finished taking all of the antibiotics. Symptoms: in women include abnormal vaginal discharge which may have a strong odor, burning sensations when urinate, pains during sexual intercourse. Symptoms in men include discharge from antepenis, burning sensations when urinating, burning on the itching around the opening of the penis, pains, and swelling in one and both testicles.
What is it and how does it spread? Well, chlamydia is, as was explained earlier, is also sexually transmitted diseases. Is caused by Chlamydia trachomatis, and it's so common and so persistent because it's a silent disease. You can have it forever and don't know you have it. pregnancies are those pregnancies that occur outside the uterus, like no rupture, and it's an increased risk of maternal mortality. As well as pregnancy complication, chlamydia infection usually occurs with preterm labors and newborn complications. Well, babies are born with antibiotic on the eyes and they're exposed to chlamydia infections.
Can chlamydia, I guess, we're always talking about cures. Is this something that can be cured?
Yes, chlamydia is cured. It's opposed to any type of other things that is cause herpes or HIV. Chlamydia is really safe. Cured with antibiotics and covers quite easy. Now, it's important that no matter how you treat it, that your partner gets treated because otherwise the infection comes back.
Pros and cons. Pros. The World Health Organization believes that each day more than a million people contract a sexually transmitted disease, STD. Some of these infections affect fertility, others cause even more worrisome health problems. Cons. These conditions can cause permanent damage to the reproductive system. This can lead to chronic pelvic pains, infertility, and ectopic pregnancy. Issue applied in Ecuador. Chlamydia trachomatis infection of the most common bacterial sexually transmitted infections (STI) in the world, occurring most often in young sexually active adults. The highest prevalence of chlamydia infections in females in the age group 15 and 19 years, followed by 20 and 24 years. Chlamydia is spread by having unprotected vaginal, anal, or oral sex with a person with a chlamydia trachomatis infection or for a mother to children during childbirth.
Chlamydia is a bacterial infection that's primarily sexually transmitted. Most folks who have chlamydia actually don't have any symptoms, but it can cause a lot of inflammation that can be uncomfortable and also be associated with pain. Symptoms associated with chlamydia include urethritis, so pain with urination in both men and women.
In conclusion, chlamydia is a very common sexually transmitted disease, being one of the most frequent and appears within periods of pregnancy of the accompanies during delivery and postpartum, affecting newborn with the appearance of pathological complications such as health and welfare of the son.
Chlamydia is a sexually transmitted infection caused by the bacteria Chlamydia trachomatis. The most common ways of
¿Quién está allá?
transmitting the infection are fecal, chlamydia, pH, and is more common among children. In 1997, the number of suspected newborns increased to
Lo
3%.
siento.
Risk of chlamydia are those who have multiple sex partners, those who practice unsafe sex, and those who have a history of other STIs. In men, symptoms can include a discharge from the penis, pain while urinating, along with tender or swollen testes. The symptoms resemble those of gonorrhea. They can appear intermittently or disappear completely while the person remains the same. In women, symptoms include an abnormal vaginal discharge, bleeding between menstrual periods, or after sexual intercourse. In both men and women, chlamydia can cause rectal itching or bleeding, as well as anal discharge and diarrhea. However, chlamydial infections are asymptomatic most of the time. To diagnose chlamydia, a test is required. For women, screening involves a cervical exam with a swab sample. A urine test can also suffice. For men, a urine test is not a qualitative and less painful than a traditional ultrasound. Chlamydia is easily treated with antibiotics. You need to take the full course of medication and refrain from sexual relations, oral sex included, until the treatment is complete. After symptoms disappear, the infection can linger in the body and still become dangerous. To break the chain of infection and to avoid becoming fully infected, you need to alert all of your sexual partners within the previous 60 days and encourage them to get screened and treated if necessary. Your doctor can assist you in clean or anonymous partner identification.
Thank you.